My name is Joel Hungate. I'm the Executive Director of Integrated Wellbeing and Strategy for Hancock Health. And we're sitting in what is truly an international thought leader of integrated well-being. This facility represents the manifestation of surround wellness, integrated well-being, the idea that the new home base for health is not waiting for us to put you back together in a doctor's office, but investing in your family early and often with physical activity, nutrition, healthcare education, right next to labs, imaging, diagnostics, your primary care doctor, so you have no reason to go anywhere else. And if we start to move that direction, the total cost of care goes down, engagement with healthy behavior goes up, everyone can win. And that's something that we've made major investments in as Hancock Health over the past decade and a half now. I'm a biomedical engineer, and I see every problem as an opportunity. And the idea, when we look at integrated well-being, where people fall short is sustainable lifestyle change. We can get momentum to keep the flywheel turning. We need community, we need the infrastructure of well-being wrapped around us, we need the resources, we need to measure what matters. And oftentimes you don't get the privilege of having all of that in one package. So when you think about innovating in a way that wins hearts and minds, gets people to say yes and stay yes to the behaviors that are going to change their health and the total cost of care, you can't solve those problems in a vacuum with a really slick program that focuses on just one thing. It has to be whole person. That means we have to have a place in a community to exercise. We have to have the know-how and the experts wrapped around us to help us with our nutrition, with our programming. And we started to look at this in about, 15 years ago. Hancock Health made an investment in this medical fitness model, where with physical activity, nutrition, healthcare education, we're going to use that as a physician extender for outcomes. Because if we can pull those levers of risk, outcomes become better because we're not just hoping that people comply with eating right and moving more, we're giving them the tools to do it. Now, around that time, we were the 28th healthiest county in Indiana. But we were about the 4th or 5th highest median household income. So that discrepancy bothered us because it's typically tied to affluence and access to infrastructure and all these things. And we thought, well, how can we make that better? Fast forward to today. 3 campuses, integrated well-being, 16,250 members across these campuses in a membership model, all of which are engaging in our facilities and visiting our facilities 750,000 to close to 1 million times today, or this year. And we've gone from the 28th healthiest county in Indiana to number 3, and we're gonna be number 1. But the biggest difference, the thing that we're missing, how do you measure some of those intangibles? How do you connect with people in a way where I'm not just measuring it, but they have skin in the game, where they know what winning and losing looks like? How do you keep that simple enough and minimal effective dose enough that we can scale that to any population, whether you are just had your hip replaced and you're trying to navigate what it means to just move again, all the way to an elite athlete and everybody in between. How do we help those folks measure what matters in terms of movement, sleep, stress, cardiovascular risk factors, all the tenets that make lifestyle medicine work? There's never been a unified way to do it. And that gap, that problem, it bothers us because we're shooting in the dark. If I don't know that you're able to achieve the type of movement that's a minimal effective dose to move the needle on a chronic condition like, say, diabetes or obesity or hypertension, I don't know how to affect change besides just encouraging you to just move a little bit more or, hey, get you in this class. What if you can't? What if life gets in the way? How can I start to take this information, build programming that is proximate to the person and their specific needs? That is the biggest trick that is yet to be cracked in healthcare because we say it's personalized, but most of healthcare is waiting for things to go wrong, and then we're gonna put you back together, and then we're gonna hope and pray you comply or that it doesn't happen again, and we send you off into the abyss, and we say, hope we don't see you anymore, but if we do, we're here. Versus, what if I could wrap all these resources around somebody and the telemetry that tells us what winning and losing looks like? That was an aha moment for us because there's 1,000 different wearables. You could put on a Whoop band, a Garmin, a Fitbit, anything. The watches you wear right now are probably tracking something. But no unified theory of what is good and what is bad. If I've got one data set, I've got one data set. We use health coaching. We have wrapped these amenities around our employer partners to reduce the total cost of care. But oftentimes our professionals don't have the depth and breadth of data needed that they can compare across the population, apples to apples, and say, this is the amount of movement that matters. This is the amount of sleep that matters. This is what nutrition tracking should look like and how it matters. This is the measurements of our cardiovascular factors. measurement of our heart rate variability, our stress, all these tenets that we thought, beforehand are just a motivational interview. I can now have objective data and scale that to entire populations. That was the aha moment when we found HealthFlexx, because not only is the band easy to use, it's set to monitor the minimal effective dose at a price point that can scale to massive populations. I don't need to spend $200 in some crazy software service fee every single month per individual to be able to scale that type of telemetry. And we have been looking for years to find somebody that could meet the price point relative to the volume that we were just discussing. So I'm talking 16,250 members in a wellness center, county of 90-some thousand at this point. And imagine my employer-based ecosystem, that's 5,200 some covered lives, all of whom could benefit from accessing this, and all of whom our clinicians could take, with whom that our clinicians could take that data and amplify their outcomes. So imagine what we could do on that front with one system to rule them all, and we didn't think it existed, especially at the price point that we're talking about. All of healthcare, the fundamental metric, the key outcome that we're all looking for nowadays, it's not purely health outcomes, it's engagement. It's sustainable lifestyle change. We have all these interventions that could be the best program on the planet. If I can't get you to commit to it and do it, it's not gonna matter. So winning hearts and minds, driving engagement, sustaining engagement is the new currency of healthcare. So to do that in our setting, we had a huge head start because we have retail, concierge style, integrated well-being capabilities. But what happens when you get a wearable, or I say, hey, we want to track something, or hey, I want you to have a food journal, right? All of the barriers that pop up. I don't have enough time, I forget to do it, it's not easy, oops, my watch, the battery just died, whoopsie daisies, I missed, or I've got to charge it every single night, how am I going to track my sleep? There are a mountain of barriers that as soon as, just like with any sales process, you need 7 positive touch points to get people to the level where they're going to say yes to something. It's the same with lifestyle change in healthcare. We need multiple touch points to create opportunity surface area for people to keep the flywheel turning. And in this case, we need to remove all those friction points that get you to say, well, you know what, maybe I shouldn't do this, or I'm okay to miss on it today. Our entire industry is fraught with those barriers, with those obstacles, and no real good way to measure that. And when we think about measuring it with some of the modalities that are available, it automatically goes from, hey, we're not doing anything right now, to let's measure everything. And I want to know how many minutes you were in theta brainwave sleep last night. It's like, that's not useful. Right. That's overkill, right? So if you can take a minimal effective dose approach, we let the data and the studies tell us what are the measures that we need to hit, how consistently do I need to hit it, how does it affect my health outcomes and the total cost of care for that individual. Well, now we're cooking with gas, because I'm pulling on levers that are simple, they're easy to explain, they're easy to comply with. And I can wrap the programming around that and make it a force multiplier for everything we're trying to do. That's how things start to happen. And in that world for us, imagine you go down the path of trying to choose a wearable or a system or a software that's going to help you track all of this. Number one, well, how often do I have to charge it? And whoops, I forgot to charge it. How often do I have to sync it? How many buttons do I have to press, or what do I have to navigate? User interface and experience is everything. The friction points are there. The idea of care compliance, I don't want to just have you comply and manage your condition anymore. I want to control, prevent, and reverse. And I need a tool that takes that exact same mindset. Yeah. And they're very few and far between. So for us, when we started to champion this idea, that was a huge flywheel moment for us. We know that these are hills that everybody dies on when we think about, like, oh, let's pick a wearable. Number one, it's probably expensive. Yep. Number two, it's probably difficult for the average user to really understand, hey, what's my pulse ox mean for this? Or what about heart rate variability? Is that good or is that bad? Now, most people don't know. What if I can make it really simple and say, hey, wear this? And we've got very simple thresholds for you to hit. And I can align incentive structures around that. I can align programmatic changes and clinical outcome tracking and clinical adaptation to the care plan, all based on really simple things that we know translate to actual outcomes. So we get rid of the noise, we find the signal, and we do what matters, and we measure what matters. And now we make that real for every patient in a way that's accessible. So just like we talk about our wellness centers creating this infrastructure of well-being, we're removing the barriers to saying yes and staying yes and accessing the best of integrated wellness and healthcare all in one. What if I did the same thing with our telemetry package? What if I did the same thing with our biometric data that we're trying to capture? And what if I could get patients to buy into that idea? Trying to craft a healthcare experience that replicates that ethos that we talked about, removing all the barriers to saying yes and staying yes to the best version of yourself. We've done that with our infrastructure, with our facilities, with our programming. Why would I not find a telemetry partner, a biometric, a biosensor partner that takes the exact same philosophy and can do the exact same thing? And we imagine those friction points. Put yourself in the shoes, the customer journey. I'm wearing a device. What is going to keep me from using it? What is going to make it difficult? What is going to keep it from being effective or applicable to my life? Easy to integrate. It's the idea that the battery dies. It's the idea that I got to sync it. I've got to navigate some sort of interface or press a bunch of buttons or understand what it's trying to tell me or respond to some sort of triggers. What if I took all of that off the patient's plate and I said, hey, put this on, sync it every night, charge it once a week, ready, break. Boy, that is a value prop that I can get behind. And our patients love it too, because imagine now I can say, all these things that you were worried about measuring or having to understand or whatever, we'll take care of that. We're your expert team wrapped around you. We just need you to wear it and sync the device. And you're going to be able to look at how you're tracking, trending. You're going to start to get a feel for what good looks like, feels like, what it looks like in the data, and you're going to start to adapt over time as well. And that only happens with telemetry that is simple. We separate the noise from the actual signal that matters. We focus on that signal, and we help give them context for what is winning and losing look like. And that's how you empower patients. So when you think about trying to get individuals engaged, it's not just that first 60 to 90 days. It's, well, how do we make this a sustainable lifestyle choice and change? Moving that direction to win hearts and minds, to make it matter for them on a daily basis, that is the art of where healthcare is going right now. To do so requires command of the why, the purpose, an appreciation and understanding that by doing so, you're accelerating the outcomes that you want, that your family wants, that is going to unlock life, the quality of life that you're after. And we talk about this all the time. Health, we often think of it as an end versus a means. What I mean by that is, we all know we should be healthy. Nobody's sufficiently motivated to be healthy just because they know they should be healthy. Yeah, it's good to eat better, of course. I should move more, I should exercise. It's not sufficiently motivating. You flip the script and say, health is the means to unlock all the things that you want in life. That adventure, go climb that mountain, pick up your grandkids, retire without pain, have the experiences and wring the marrow out of life to the full. Your health unlocks that. And the story we tell in our setting, whether it's with the telemetry, with our programming, with the things that we're wrapping around the patient, is that everything that we're bringing to bear on your behalf is a force multiplier for that life that we're going to unlock for you. It's a force multiplier for the person you want to be and sustain. And your buy-in on that is what is going to make or break this. So number one, you got to get the story and the why right. Number two, it's got to be simple. Simple plan, easy touch points, checkpoints, adapt, pivot or persevere. What's working, what's not? How do we treat this as a whole person approach to sustainable lifestyle change? And it's not just, hey, I need your steps to be X, Y, Z. It's like, hey, I noticed you didn't sleep very well last night. How are you feeling today? You know, what's your temperature look like? Has that been consistent this week? We can ask the next best question with the next best data that we have available. And that allows us to go deeper. And it's not just, yep, hope you did it. Good job, you hit your steps. It's what's going on. How can we help remove even further the barriers that are keeping you from moving the needle on your health and well-being? And that happens at the frontline level of everything that we've created. So if you imagine launching this and getting that sustainable lifestyle change, what could programs look like? For us, we already have a really robust clinical exercise program. Our physicians, anybody outside of Hancock Health, can prescribe exercise in our facilities. Click of a button, 8 weeks of one-on-one or small group-based training specific to conditions. Diabetes, general deconditioning, hey, I just want to get healthier, cardiovascular risk factors, cancer, orthopedic issues, perinatal, all these conditions. You find people that are on a similar journey as you go through a program together. It's been wildly successful. One of our things that we've found is that we can start to align incentives around that program to say, hey, join this program, get a band, receive that telemetry, understand it, live it, walk, talk, breathe what it means to measure what matters, graduate from that program, finish it, keep the band, get a break on having any cost out of pocket for the fully robust telemetry and dashboard we're going to provide for you for X number of months, and then you can assume that cost and become a member at your own expense. We create an on-ramp for people to say yes, that's cost effective, they get the buy-in, they understand the value, and now they're beyond the sale. They're like, well, I can't imagine doing it without this. And imagine the other populations we can start to scale that to. I've got 5,200 covered lives in our direct-to-employer ecosystem where they pay us one capitated rate per employee per month to cover their whole family. Unlimited primary care, labs, imaging, or access to our labs and our pharmacy on site. We referrals for everything that we do, but access to health coaching, clinical exercise programming, the wellness centers. What if this was also a part of that experience as well? So the whole goal is, it's not that it's a standalone thing that we say, here, why would you not want this? It's a part of the package. It's a part of the experience. It's embedded. It's the mechanism by which we show you what winning and losing looks like, and we show you what sustainable lifestyle change feels like, and then you can see it in the data. You can trend it over time. Yeah. We make it real for the patient. So when you're thinking about telemetry, and again, my little engineering heart's gonna be so happy to answer this question for everybody here. The idea of the quality of the data matters. And just because a sensor can measure something doesn't mean it's repeatable. It doesn't mean it's reproducible. It doesn't mean that I have intra-rater or intra-facility reliability or intra-device reliability. You have to think about the complexity of what you're trying to measure is indirectly proportional to typically the ability to measure it accurately, right? What I loved about HealthFlexx is that they made no bones about it. They said this sensor, it measures movement, it measures sleep, it gives you a platform to engage with an AI health coach and document your nutrition. It measures heart rate variability, pulse oximetry, temperature, all these things. And whenever they bring that to bear, we make decisions on this sort of data. I need to know that it's accurate. And I have extreme confidence, not only if we tested it, but I've had extreme confidence in the fact that they don't overcomplicate the signal. And if you don't have to overcomplicate the signal and you don't have to derive things from it and manipulate it to get some sort of meaning out of it, and if it's consistent over time, you versus you longitudinally, that is so powerful. And if I can trust that data, because they're not trying to boil the ocean, because we're doing what we know matters, minimal effective dose, we're gonna measure something simply and accurately, it unlocks a whole new realm of clinical decision-making for us and a whole new data set to help augment and give context to that patient experience. Whether they can articulate it or not subjectively, we can now arm them with a mechanism to look at how they're doing, see it over time, get a feel for when things are trending off course or on course, or when they're improving. And now we've got a common language to discuss what activity should look like, what sleep should look like, what stress should look like. And then what levers do we pull to help them manage all of that? You cannot do that if you overcomplicate the signal. You cannot do that if the signal is not accurate.
How's HealthFlexx going to save you guys money?
So the million-dollar question, quite literally, is how does something like HealthFlexx save us money, save an employer money, save an individual money? The future of healthcare, like I've said before, engagement is the currency. We measure winning or losing by the total cost of care. It's not the price of healthcare, it's the total cost of care. The most cost-effective insurance that you can buy, and I'll brag on this, a membership to one of our wellness centers. You're investing in your physical activity, nutrition, healthcare education early and often so that you don't have the big scary things have to happen that are also costly at a main campus at a hospital. And again, hospitals are more than happy to provide that service. There's oftentimes time where we're not gonna be able to avoid having to access some of those services, but it's a probability game. If I can reduce the opportunity surface area for big, scary, expensive things to happen to you and your family, I'm going to save you money over the long haul. But oftentimes you don't pay full freight for that. The employer does. Taxpayer does. Someone does. Someone's always left holding the bag. Somebody pays for this healthcare. We have a huge problem. We have almost a $5 trillion a year healthcare problem. $1.15 of every dollar spent on the planet any given year is spent on American healthcare. Think about that. The only way we affect this is getting ahead of the supply-demand problem that we have, which is we're not doing anything to eliminate the lifestyle factors, the integrated well-being practices that we need to adopt. We're not doing anything to head that off at the pass. we're often just waiting for it to become a problem, and then we're measuring how cost-effective our solution to fix it, to put it back together happens to be. And I'll give you a hint, we often can't put you back together as good as the good Lord started with. So what if we could head this off at the pass? What if we could reduce that total cost of care by reducing the probability that these chronic conditions, these lifestyle factors, these social determinants, these barriers to sustainable lifestyle change, if I can remove them, I'm increasing that opportunity surface area for you to not need the expensive care. Somebody pays. That starts to manifest rather quickly. I'll give you an example. The numbers are almost shocking. People think that you have to go from heavily multi-morbid, I've got all these conditions, I'm really struggling, I'm overweight, I don't feel well, I can't move, that I need to go from that to Olympic athlete, CrossFit Games athlete, elite athlete. You don't. If I can take you, as we joke, and are often want to say, and was a quote by a friend of ours, Mike Stack up in Michigan, the data shows you need to go from couch potato to potato. If I can just get you to do that, then, for instance, if you are diabetes at very high risk, if you have a patient struggling with diabetes, very high risk, and I can move you to just diabetes with high risk, that can be on the order of $100,000 to $150,000 an employer could save per year in the expensive, multi-morbid, highly reactionary, highly interventional care that high-risk person would have required by eliminating that cost factor. And that's just by going from doing nothing to taking a control, prevention, and reversal mindset and walking alongside a patient and giving them simple, sustainable lifestyle change things to do. Take a brisk 10-minute walk after you eat. It does wonders for blood sugar and A1C. Engage in physical activity. Hit 10,000 steps 75% of the time. And show it could reduce up to 30% of the cost of care. It's very, very small steps that result in this incredible outsized gain in economic benefit for the employer, for the out-of-pocket expense, for the family, for the burden on society from productivity, absenteeism, presenteeism, all of it. All spheres converge on health. And when you can measure what matters and you can move the needle on what matters in a cost-effective way, hitting the minimal effective dose thresholds to get a response that moves the needle on that total cost of care, that is the literal definition of value. We're taking the lowest input cost and achieving the highest outcome, lowest effort, highest impact, and we're doing it at scale. And for us, the marriage of the HealthFlexx data with our world-class programming and our world-class destination for integrated well-being and the thought leadership and the incredible quality of care we offer at Hancock Health and what we do in the community, that's how we're going to reach our goal of being the healthiest communities in all of Indiana, all of the nation. We're top 4% of the nation. We want to be number one. And how we're going to be the destination health system for folks that believe it can be different. And this data can help us tell that story in a way at the individual and the population level. It just doesn't exist right now.